The following segment is sponsored by Pacific Northwest Pet ER and Specialty Center.
Here's a live look from the Anna Spanish Head Resort Hotel in Lincoln City. Thanks for watching Afternoon Live. Well, if you want the very best in emergency care for your sick pet, Carrie Williamson visited a local facility that delivers state-of-the-art care to help heal your furry family members.
I am here at the Pacific Northwest Pet ER and Specialty Center in Vancouver, Washington. I'm talking with Paul Chauvin. Dr. Paul Chauvin, you are head of the ER department. Tell me what happens here at your emergency room.
Sure. Well, we have, first off, we're a multiple specialty and ER hospital. So we have oncologists, we have internal medicine specialists, we have surgeons, board-certified surgeons, internal medicine specialists, and we also have a new neurologist. We have critical care specialists too, and that's an important service that should be talked about because they manage the more intense cases. They're also here for guidance and mentorship for our emergency doctors.
So you really do handle it all here?
Yes.
Yes.
Yeah.
So it is so scary as a pet owner when your pet is sick. So how do you know when it's a true emergency and you should come to an emergency vet or just wait and call your own vet in the morning or on a weekend? What's the best?
So we try to help with that. The first step is to either call or go online and start the online registration process. They can put in information, history, what the pet's age is, all that type of information, and then we reach out to you either by phone or by text or email, and we start that dialogue so that we can determine, is this a true emergency? Is it something that's urgent? Is this something that's really critical and should come in right away?
And I love that you have this program where people can call in and get in line to bring their pet before they bring it into your door. So they're not stuck with a sick pet sitting in your waiting area.
And not just call in. They can go, again, onto our website and they can start the registration process. We have a virtual waiting room so they can see kind of where they are at in the queue to be seen. And we're constantly revisiting that with our triage team and our doctors to manage that list so that we can see as many people as possible.
That is so helpful. Yes, and what are some of the most common cases you see that people bring their pets in here for?
Yeah, there's a wide variety of emergencies that we see. It could be anything from something that they've ingested. There's a lot of gastrointestinal cases that come in that some are more severe than others. A number of different trauma cases, from bite wounds to vehicular trauma, that we see on a regular basis. There's respiratory cases, and there could be a lot of different reasons why pets are having difficulty breathing. Anything that's bleeding or painful, or if that problem's been going on for a long time and it isn't getting better, then it's best that they be seen sooner rather than later.
Yes, and you are a 24/7 facility, so if someone came in and let's say their dog swallowed a sock and they need surgery, you can do it right here.
Right. We do have on-call surgeons. We also have, quite a few of our own emergency doctors that do procedures, and we have criticalists that will come in on off hours. So we tried to get things done pretty much in a timely manner. If there are certain surgeries that really shouldn't wait, others that can be stabilized and tackled by our surgery team the next day. But yes, 365 days a year, we never close.
And do you have any advice for pet owners on how to avoid getting here in the first place?
How to avoid it? So that's
yes.
a good question. And a lot of it has to do with preventative care. Working with your primary care vet routinely, making sure that you're doing annual lab work, maybe a little bit more than that as pets get to be older. So a lot of emergencies that we see really have been going on for some time, that something just tipped the scales and declared itself as an emergency. Keeping your pet in a confined area, keeping all your toxins in your pill bottles and all those things out of reach. Getting online and looking at resources like ASPCA's toxicology website and Pet Poison Helpline. They have long lists of things that your pet should not be exposed to. Really becoming educated about what it is to be a pet owner can really help prevent emergencies from coming in.
Well, I can tell that a pet's going to get great care and a lot of love when they get here. I can tell from talking to your staff and seeing the wonderful care you're doing here. If you would like more information about the Pacific Northwest Pet ER and Specialty Center, you can check out the information on our screen, or you can always go to KATU.com. Thank you so much, Dr.
You're
Chauvin.
very
It was
welcome.
wonderful to meet you.
You bet. Hopefully we won't have to see you at 4 in the morning.
I hope so. Let's hope. Okay, back to you.